Hello, everyone. My name is Rachel McGill. I'm the Healthcare Workforce Liaison for JMG. My position is a partnership with Maine Health, and this webinar series that we host every month kind of highlights a different career opportunity for students to consider as they are going through high school and college and making their post-secondary plans. So we are really grateful today to have Dr. Kristen Mazoki with us, who is from Franklin Behavioral Health Services. Thank you for joining us this afternoon.
Thanks.
So I'd like to start out with having you talk a little bit about your individual career path, how you got to where you are today. We found with a lot of our guests that it's not always a very linear path. So could you talk about, how you got to your current role, and maybe did you always know you wanted to work in healthcare?
Well, sure. And yeah, mine was not linear either. So you must be getting a lot of people who took a storied route. I was interested in healthcare, but I'm interested in a lot of different things. I always have been. And in college, my major was neuroscience, and I was between kind of healthcare versus working in labs, and going more of a biomedical sciences route. After my undergrad, I worked in a lab and found that I didn't think the PhD route was going to really be for me, like the basic science route. So then I actually went and did a 1-year nursing program. So
Oh,
went and in 11 months, I got my bachelor's of science in nursing, and I started a job as a substance use nurse. So I was in the mental health care field at that time as well. And then didn't really feel like nursing was meeting what I was looking to do. So then I applied to medical school and went to medical school. So that's how I kind of came to be here. But I will say I grew up in an urban area. I grew up in Philadelphia, and seeing a lot of homelessness growing up and seeing a lot of substance use for people that were living on the streets and people that are not living on the streets. That's kind of what propelled me in this direction and has led me to various types of science and healthcare along the way.
oh, wow. Thank you for sharing that. That's great. To kind of see the progression of the jobs and roles that you've done to kind of where you are now. I think that's helpful for our students to see for sure. Um, so in your role now, could you talk about what a typical day might look like? Like what kind of tasks you perform, the environment you work in, and who you maybe interact with most throughout your kind of work
Yeah.
day?
So I'm the medical director here at Franklin. So in my group, I have two other physicians and two nurse practitioners who work with me, and I'm responsible for supervising them. I have a medical assistant. We have a few medical assistants in the department that work with us. I have a clinical nurse navigator who works with me and is kind of an extension of myself. So those are kind of the colleagues in the office part. That's my outpatient role in the outpatient world. Here, I consider myself a full spectrum rural psychiatrist, meaning that I take care of a lot of different aspects of people's mental health and in different settings. So in addition to being the doctor you might see, if your primary care wanted you to have a little extra input on something like depression or anxiety or trauma, or in some cases when people's minds are playing tricks on them, you might get sent to someone like me. That's the outpatient care aspect of my job. I also round in the emergency room for any people in crisis. I also go to the medical floor of the hospital if someone is here with a medical issue, but then also has mental health needs. I will help the hospital medicine people treat their mental health needs. And then in addition, I spend time in the operating room, which might sound strange for a psychiatrist, but there is a life-saving intervention in psychiatry called ECT, that's short for electroconvulsive therapy, and that's a procedure that's for treatment-resistant depression. And so I spend time in the operating room doing those procedures, which is pretty valuable service, especially in a rural area. So I'm in a lot of different places. I also will go to a nursing home every now and again if they need me. If there's someone in the nursing home that has mental health needs and they're having a hard time addressing them, I'll go there and try to help out with that. So that's the best part of my job, is the variety and the interdisciplinary team. So I'm interacting with both my team, my doctors, nurses, and medical assistants, but I'm also interacting with the emergency room team, with the hospital team, which are internal medicine specialists, typically, and family medicine specialists, all the primary care doctors and primary care advanced practice providers. I get to talk with them about their patients' mental health. And then the geriatricians, really whoever kind of needs a little bit of help. I also spend time advocating, because there are many people with mental illness who do not have a voice. And I think it's an important role of my job as a leader in this field to make sure that their voices are heard with our, our legislature.
Yeah. Man, you touched on so many things. I'm so grateful for your responses there. But I love, like, what I'm gathering is the variety of the work that you do on a day-to-day basis, that you are maybe not know what a typical day is going to look like for you when you walk in. So having students understand that there is that level of kind of unknown, or going where the need is that, do you find that this is typical of kind of like a smaller community, where you're kind of so enmeshed in the different layers of that community care, or is that typical, you think, in like an urban setting as well?
So I think this is a big part of being a rural doctor, is that you kind of jump in where you're needed in more urban areas, but really Maine is a rural state. So if you're practicing in Maine, services are typically going to be limited. Even in Portland, where we have a lot of mental health services, the wait times are pretty extensive. So you wind up managing, a lot of things. And I feel trained to do so. You have to be very comfortable jumping in if you're going to work in rural settings. And you don't know what's going to come to you any given day. In academic settings and university type of mental health practices and psychiatry practices, it is more like specific types of psychiatry. Like, you're an ER psychiatrist and you work in the ER, or you're a consult liaison psychiatrist and you only work on the medical floor doing consults, or you're an outpatient psychiatrist. I specifically came here to be able to do multiple things. Interventional psychiatry is a field for people that are doing things like ECT, and TMS that's transcranial magnetic stimulation, which is another treatment for depression. So there's interventional psychiatry. So you can definitely find more of a niche area and work more specifically. But I find that in psychiatry, as a medical profession, you can kind of choose your own adventure.
Mm. No, that's so well said, and specifically in Maine, just because it does seem like such a unique state, just for all the demographics that you mentioned. But I think that's important for our students to know. So thank you. Um, so you mentioned a little bit about the education and training that you've had. Is there anything else you want to kind of say about what that process looked like, of what's required to become a doctor or a psychiatrist
Yeah.
specifically?
So it's a marathon, not a sprint, for sure. So after 4 years of undergraduate, you're applying to medical school and kind of accumulating the classes you need during your undergraduate degree to be able to apply to medical school. The application process to medical school is almost a year-long process. There's primary applications and secondary applications. It's a very costly process. Some people need to take out loans just to be able to apply, like in the thousands of dollars range to apply to medical school. And then you interview where you get interviews. After you're accepted somewhere, it's a four years of medical school. And then at that time, you begin to apply to residency programs. In your first 2 years of medical school, it's mostly didactic training, meaning that you're in the classroom learning the background information you're going to need to pursue a career in medicine. And then in your third and fourth years, you're doing your clerkships, they're called. And that's when you're on the medical floors learning specific types of medicine. And that's typically where you decide what type of specialty you would like to do. and then begin accumulating experience in those areas so that you can then apply to residency. Residency is an interesting process, and we could have a whole conversation about that. You interview for different programs. They rank you on a list, you rank them, and it's a binding, it's called the match. It's a binding list commitment to where you could go anywhere that you put on the list, and then you're sent a letter all at the same time of which place you matched. That's what it's called, the match. And then you go there, and psychiatry specifically is a 4-year residency. So during that time, you're paid a nominal amount. It's not a lot, but you are paid versus paying for medical school. And they've recently instated in the past decade, they've instated some work hour requirements to where they try to make it a little more fair, but it's 80, right? 80 hours a week. So you can't exceed 80 hours a week, and that's an average over 4 weeks. So the time that you spend in residency is very, very busy, and having a supportive system in place prior to residency is pretty important.
Yeah, I think I'm tired just from hearing that process a little bit. And we talked offline about maybe doing another video just kind of specifically about medical school and what that all entails. So we'll definitely talk about that in the future if we're gonna post that out. So thank you for your willingness to kind of speak to that. Um, I've had a lot of students interested in behavioral health work, and I'm curious if you could maybe list some interests or characteristics or skills that might make somebody a good fit for working in the realm of behavioral health in general.
General positive regard for other humans. So, and that sounds like a simple thing, but it's not a simple thing. That's if you need to have positive regard for people that you might not be agreeing with their choices, or you might not understand their, where they are in their lives, but you're willing to care for them anyway. You might be when you're in the mental health field, the behavioral health field, you might be the only person that's kind to someone that day. People come from all walks of life, and you see a lot of people with histories of trauma. But so I would say the ability to have positive regard for fellow humans is the number one trait required to be in this field. And then secondly, being kind of level-headed. The things that you hear and the things that you see, it can be a lot. Sometimes you might need to debrief and talk about it a bit, but being able to kind of find that calm and be that calm for someone. So level-headed, generally caring. I think it helps if you're, I don't know a good way to say it, have common sense too, right?
Mhm.
There's a lot of other areas in medicine that are more like algorithmic, like you have an infection in your lungs. The infection responds to this antibiotic. You prescribe that antibiotic. Mental health is not really like that. Psychiatry is not really like that. Different things work for different people. And it's really not black and white. So you have to have some, we would call it in the biz, cognitive flexibility. So you
Mm,
have to have the ability to be like, okay, well, that did, like, problem solving skills. Like, okay, well, that
yeah.
didn't really, and get creative with it. And it might be, sending someone to their local, they used to go to church, and that was very soothing to them. So you're kind of enhancing their spiritual health, and that helps their mental health. So being willing to work across disciplines and get creative.
Mm, that's lovely. I think that's a really good way to kind of, if you had to encompass it down into one thing, like having the empathy and compassion for somebody, but also being to look at them as a whole human. And yeah, that's great. Um, we are hearing that, in healthcare in general, there are a lot of staffing shortages, and you kind of even mentioned that in some of our behavioral health facilities, there's long wait times for people to get services. Are you seeing workforce shortages, and kind of what are some of those areas look like? Are there entry-level positions that people could start in if they wanted to kind of work their way up? What are you seeing on your end of things?
Yeah, there's shortages in every single area. And you can, if you're interested in interacting with with patients, behavioral health patients. You could be an MA, you could be a CNA on the floor, you could be a CNA in the ER. If you want to come at it from more straight up behavioral route, you could go into like a behavioral health aide. Now, different states have different abbreviations for this. BHA, BHP, there's a lot of different abbreviations, but it's essentially someone who works one-on-one with a patient with needs. You could be a home health aide. You can work at one of the mental health hospitals as a tech, a psych tech. And those are typically entry-level positions where you could see if it's a field that you're interested in.
Yeah, that's great. And we actually, we've done a webinar with medical assistants, with certified nursing assistant, and with a couple psych techs as well. So you can always refer back to those videos too if you guys were interested in kind of knowing that you could maybe specialize or kind of focus or be in an office that's serving mental health in that capacity rather than going full bore right into like your medical school pathway. So that's really helpful for, I think, for them to know there's kind of stages and a career ladder that they could work through if they wanted to.
Mhm. And you can do psychiatric nursing too.
Mm.
You can go right into psychiatric nursing, and there's like training programs after nursing school that you can sign on and specialize, in psych nursing. If that's an interest too, there's a big need there.
So they would do their 4 years of nursing or 2 years if they were going in for their, and then there's just a specialty training on top of that that they would go to.
A lot of the psych facilities to encourage people to go into the field are having like, extra mentorship, like 6 months of, additional training, so you feel supported and you feel comfortable like going into the field.
Mm, that's great. I think you talked a little bit about maybe your why or why you're doing this work, but maybe you could, if you had to kind of think about what the most rewarding aspect of this job is, and then kind of on the flip side, maybe what's the most challenging part of your role, what would you say those are?
Well, I like to be a resource to other physicians and nurse practitioners and kind of help them through with patients. Every minute that I spend with patients is pretty rewarding. Um, that's the best part of my day. The administrative stuff that I have to do as a medical director is definitely the worst part of my day. Most people don't go to med school to want to be on meetings and stuff. Um, but the patients, when they get a little better, when they, there's a patient, there's an acuity level when you're in psychiatry, the mental health, where sometimes you're trying to keep people alive, you're trying to keep them out of the hospital and quite frankly out of jail. And when you can see someone functioning, when patients get a job, that is like really wonderful. When you see someone get a job, it can help with purpose. When you see someone be able to get their kids back or start
Mhm.
spending time with children again, that's really wonderful. Those are some of the best parts. And then, worst parts, I would say the admin stuff. There is so much licensing and credentialing involved in the medical field that you're staying up. There's always some sort of extra education that I have to do, like pretty regularly, and applying for different licenses, medical license, board certifications, lots of testing. So maintaining those things can be challenging. And then, when you can't help every single person. So I think that part's really hard too, is trying to leave it. My dad's a nurse and he used to say, leave it on the elevator, but
Oh,
leaving it here and not taking it home with you. I think that's the hardest part for me because I'm really invested in this small community that I live in. So trying to not let it affect my personal life, in the mental health field, I think that's probably the hardest thing.
yeah, and that's so important too. I think for people to understand that if you do have that empathic personality, that could be something that you are physically taking this on and emotionally taking this on, and how can you care for yourself while you're also caring for others in that way. So um it's a realistic part of the job, and I appreciate you talking about that. What could a high school student who's interested in these fields what could they do now? Or what would you give some advice for them if they were kind of considering exploring this at this point?
I imagine there's some opportunity for just talking with people who are in the fields, right? Um, Talking to people who are in college now, like pre-med people in college and what they're doing. And one of the things I thought of while we were talking that I think is really important to comment on is the difference between a psychiatrist and a psychologist. This comes up
Mm,
all the time. Psychologists typically have either a PhD or a PsyD, and psychologists do very intensive therapies. They have a doctoral level degree in providing therapeutic interventions. And it would be great for you guys to talk to a psychologist as well. In psychiatry, we first learn to be a physician and then specialize in mental health. So I will check for diabetes. I always am measuring for hypertension and looking at cholesterol. So I do the medical things too. So
mhm.
that's an important distinction that I just wanted to comment on because I think a lot of times in high school, especially, people will kind of have this idea and they do fork those two paths. The psychology doctorate versus a medical degree. And it's kind of important to think about if you want the blood and guts in med school, because you
Yeah,
have to
yeah.
you have to do that just like a surgeon does. Like I did surgery, right, to get here. So it's different in that way. The training is very different. Um, but I forgot the original question, but that was just something I think, oh, what can high school students do? Well, like learn the options, I think, and figure out the options. I was a nerd forever. So and I use that term very positively. So like an Excel spreadsheet with, if they're using Excel spreadsheets anymore, the youth might have something, I don't know. But with the different jobs and like the schooling required, the salary you'll make versus the cost of the schooling.
hmm
Um, that's an important consideration. And I think that's where I would kind of get at in high school.
Yeah, the financial considerations, the time that it takes, and knowing that there's employers out there like Maine Health who will allow you to go back to school and, help offset some of the costs while you're training. So there are employers that can help with tuition to a certain degree. So getting your foot in the door with some of, the training programs that they do and then starting there and moving up. There's all different ways you can go about it, but yeah, it's kind of knowing what those options are and going in with an informed mind to make the best choice for you.
The
Yeah.
finances are very daunting when you look at medical school. So it's important to consider, how much you're spending with potential salaries and things like, I don't know if you even want me to say on this what my student loan burden is at this current time. I could tell you the balance, but Maine Health pays some towards my student loans, and I'm part of the Rural Health Service Corps, which
hmm
helps with payments. So there's options, but it's a big bite. It's a big
hmm
bite.
Yes.
I couldn't do anything else though. I always like finish if I'm talking about the expense of medical school. Like I I couldn't do anything else. This is like the only job that I could see myself doing.
Well, that's good. Then you're in. It could be worse if you were thinking, "Oh man, I have all this debt and I don't even want to do this job." So at least that's good. Um, I know we could only like scratch the surface of kind of your role and all that you do and trying to help students kind of have an awareness and knowledge around that. But thank you so much for your time. And I don't know if there's anything you wanted to leave our students with, but I think they had a really good start and possibly some links for some more resources in the future for us to kind of talk further.
Yeah, I would say just continue exploring. There's also like a lot of medical conferences that you can go to for
Mm,
free as you get into college. Um, Talk to people, they're interested in talking to you. I think one of the ways that I've gotten to be where I am is because I'm not afraid to ask questions, like, and I'm not afraid to email someone and say, hey, I found your name and I understand that you're involved with like addiction medicine in Scarborough or whatever. and just ask the questions. Most people, if you're in medicine, you are used to paying it forward and educating other people. It's a really important part of the job. Even here in a rural setting, I have medical students from Tufts. There's medical students from University of New England here. There's nurse practitioner students here, and I also will have residents coming up to spend time with me. So just ask the questions and don't be shy. Anyone would talk to you, because we really need to continue to build mental health workforce in Maine.
Excellent. Thank you so much again for your time today. It was a great conversation. I appreciate it.
Yeah, you're welcome.